Today is World Malaria Day. It is an international observance commemorated every year in recognition of global efforts to control malaria. Globally, 3.3 billion people in 106 countries are at risk of malaria. In 2012, malaria caused an estimated 627,000 deaths, mostly among African children. According to the most recent World Malaria Report, death records reached 429,000 and 212 billion new cases in 2015. The rate of new malaria cases fell by 21% between 2010 and 2015, and malaria death rates fell by 29% in the same period. In sub-Saharan Africa, spread and death rates fell by 21% and 31%. Advocates against the spread of the disease want more efforts made by governments to stem the spread. And joining me now to discuss this day that is so important to health safety in tropical Africa is a public health consultant, Dr. Nsiabasi Ekanem. Good to have you join us.
Thank you. Thank you for having me.
So talk to us about why it has been so difficult, or why malaria is still a public health concern, even after so many years.
Well, thank you. As far as malaria is concerned, I think we've made some progress. From the year 2000, when the Global Fund really started investing in malaria elimination program, up until now, we had millions of deaths. As at that time, right now, we have barely less than about 500,000 deaths globally from malaria. The major challenge that we have, or what I could call a setback in regards to malaria elimination, is the fact that the malaria parasite, which is the Plasmodium falciparum, is constantly develops resistance to anti-malarials that are available. That is why we have been moving from quinine, as you would know, up until now, where we are using the artemisinin combination therapy. Unfortunately, the way we use malaria in anti-malaria medication in Africa, issue of non-adherence or non-compliance with medication helps to build even more drug-resistant variant or species of malaria parasite, and which is one of the challenges that we have. In fact, as I speak to you, reports are already showing that there are cases of malaria parasite that are even resistant to the newest, which is the ACT, the artemisinin combination therapy. So this development of new drug-resistant variant is a serious on the wheel of progress with regards to eliminating malaria pandemic from the world. Some countries have made serious efforts in the past. Even China has been declared malaria-free. We've had other countries that have also achieved that, Oman, Argentina, and many other countries. I think what Nigeria should do, what Africa should do right now is let us embrace the malaria vaccine, which provides up to about 40% protection against malaria. So recently we received a report that over 1 million children have been protected from malaria with the vaccine. So I think it's necessary for us to expand access to the vaccine so that we can reduce the burden or the cases of malaria, in Africa. That way we can move towards, elimination. Because by the time we have lesser number of people infected, then of course we'll have lesser number of mortality due to malaria, and that is a very good progress towards achieving elimination.
And I guess that's where the theme of the year, which has to do with harnessing innovation, really comes to play with the vaccine. But let me just ask you quickly before I let you go: is there a lifestyle angle to this? Especially because it's a sub-Saharan African problem. Is there a lifestyle angle to this? Is that something that people need to do in terms of reducing the burden?
Okay, yes. Of course, when you talk about incidence of diseases, you look at what we call the epidemiological triad, where you have the causative organism, which is the pathogen, you talk about the environment, and you talk about, of course, the vector. Now, unfortunately, in Africa and most part of the low and middle income countries, environmental sanitation is so poor, and the vector, which is mosquito, thrives more in in unclean environment where we have stagnant water, we have sewage, poorly disposed sewage. This is some of the things that you find in most parts of Africa. And that is why mosquito, which is the organism that transmit malaria parasite thrives more in these areas. So one of the things we can do is to improve our sanitation. We should make sure that we dispose refuge very, very properly. And then, of course, we should be able to maintain healthy environment by cleaning up and making sure that we don't have stagnant water all around.
Absolutely.
The use of...
All right, thank you so much I think people should take that into consideration, ensuring that your environment is clean. Most infections have to do with hygiene, and that's quite important. Thank you so much for talking to us. Public health consultant, Dr. Nsiabasi Ekanem.
Thank you for having me.